Well, good evening, everybody. Welcome to the Radicle Health Summer Lecture Series. I think this is our fourth presentation out of 8 total. So hopefully you guys have been joining these short little snippets of education. I'm Eloise Theisen. I am the CEO of Radicle Health. I'm also an adult geriatric nurse practitioner working at Stanford in the Palliative Care Department, and I am joined by my co-owner and business partner, Timothy Byars, who is the President of Education. And I'm giving you a new title today, Timothy. I think you should be the Chief Scientific Officer as well, or Chief Science Officer. So there you go. You got a promotion. No pay raise, though. All righty. So just in case you're wondering what's next, because you just cannot believe how great this information is, this free information, you can join us next week where Timothy will be presenting on emulsions and cannabis beverages. It's definitely one you do not want to miss. And then we're going to skip a week. And then I will do case presentations and vaping safety in a similar format to today. And then Tim will be presenting on the future of fermented cannabinoids. And then we're going to end together presenting on using THC and CBD and looking at the science and clinical applications of using them together. And in case you didn't know, you can go ahead and go to our website and sign up for the Radicle community. It is free, and you will get notifications about any of our upcoming free content. You can also sign up for our YouTube channel where all of the recordings will be and are up there for your viewing pleasure. And if you just want more education beyond what we're giving today for free, we do have paid content that you can purchase as well. And we do give continuing education for nurses if this is something you are interested in as well. And our presentation today is for educational purposes only, and the information presented is not intended to be suitable for medical advice, and it's not meant to help in the diagnosis, prognosis, or treatment of any virus, disease, illness, or condition. All right, we got all the good stuff out of the way. So I wanted to present today about transdermal patches, specifically looking at cannabinoid transdermal patches, because I think they're a really unique route of administration that we have access to. And I'm also wondering, do they really work the way that we expect them to work? What is the science behind transdermal patches, and how have we applied that to the cannabinoid world? We know that transdermal patches can treat a variety of conditions. So we see them for high blood pressure, motion sickness, pain, migraines, nausea, smoking control, depression, Alzheimer's disease, Parkinson's disease, angina, ADHD, and even birth control. Well, we know that the industry uses permeation enhancers. Sorry, not the industry, cannabis industry, but in the pharmaceutical world, they're using permeation enhancers, these vesicles, drug carriers, liposomal, polymeric carriers, and physical permeation enhancers to help these medications actually get through the skin and into the bloodstream. So the question is, do they use those as well for the cannabis patches? Well, we'll get to that. We know that the mechanism of action is that it needs to penetrate the many layers of skin. And I'm going to show you a diagram with these different layers, and particularly how the ECS is distributed through our layers of the skin. But we have the outermost layer, that stratum corneum. It's the thickest layer and contains the most layers of keratin-heavy corneocytes. Additionally, there are 2 different regions in the stratum corneum that require the medication to diffuse through both in order to work successfully. And we have an aqueous region is at the outer surface of the keratin filaments, and a lipid matrix between filaments. So this is a diagram of the endocannabinoid system of the skin. And what you can see here is we have our top layer up here, right? So here's our epidermis. And you can see we have lots of different receptors in here. Down here, we have our CB1 and CB2 receptors in the hypodermis and the sweat glands. We also have some cannabinoid receptors, and up here as well where the keratinocytes are at. But we also have like TRPV receptors as well. So why is that so important? Well, we know that phytocannabinoids are highly lipophilic, and they have low aqueous solubility and are prone to degradation due to their sensitivity to light. temperature, and auto-oxidation sensitivity. So transdermal cannabis products have shown higher bioavailability rates with chemical enhancers and prolonged steady plasma concentrations when compared to other routes of administration. In fact, we've seen steady states that have been observed in human subjects for 48 hours with administration of the transdermal patches and 72 hours in marine models. And some of you may or may not know that CBD is more permeable than THC due to its lipophilic nature and low molecular weight. And CB1 receptors are found on the skin and blood vessels, as I showed in that diagram. And CB1 receptor expression is found in the keratinocytes, hair follicle cells, sebaceous glands, sensory neurons, melanocytes, and immune cells in human skins. CB2 receptor expression is found in keratinocytes, sebaceous glands, sensory neurons, and immune cells. And we have our TRPV channel receptors that are expressed in skin cell types too. So you may be asking yourself, remind me which cannabinoids will attach to which receptors. And this is one of our diagrams that Tim put together that's really helpful. And you can see that THC is a partial agonist at CB1 and CB2, and CBD doesn't necessarily interact directly with that CB1 receptor, right? So what about with the skin? It's a weak antagonist at CB2. If you look on the left, though, you'll see TRPV. We have 1 and 2, and then we have TRPA1, and THC and CBD are agonists for the most part with those receptors. So, this is going to kind of come into play when you start to think about which cannabinoids would I want to use in a transdermal patch for which symptom control. We know that when we're going to administrate a transdermal patch in the pharmaceutical world, if we're using something like a pain patch, for example, we want a clean, dry area of skin to apply the patch. We want to make sure we don't touch the adhesive side of the patch, right? Especially if we're using a pain patch. We want to make sure that we press the adhesive side of the patch to the skin and apply pressure for 30 seconds. The thing about cannabinoid patches that's a little bit different than some of these other patches, pharmaceutical patches like the birth control patches or the pain patches, is that the manufacturers of cannabinoid patches that are designed to be transdermal are actually recommended to go on a thin layer of the skin. So on the inside of the wrist where you see a good blood supply, or the top of the foot near the ankle. And that again is because if you go back, there are so many layers of the skin that we are trying to penetrate here that it can be really difficult to expect these cannabinoids to actually get all the way down into that hypodermis layer and then reach the blood supply. It's also really important that they write the date and time on the patch when it is applied. So what are some of the adverse effects or barriers to these transdermal patches? Well, mostly you're going to see skin irritations or reactions. People can have allergic reactions to the adhesives. They might get some itching, burns, or redness. If they continue to apply the patch to the same area each day, they will get what almost looks like a chemical burn. So it's really important that when we are recommending these patches that we instruct them to rotate the site each time they administer a new patch. We also know that using too many patches can lead to medication overdose. Now, are we concerned about this with cannabinoid patches? Not necessarily, but maybe some of the pharmaceutical patches, absolutely. And in some cases, being too hot or having a fever can actually increase the rate at which some of the medication is diffused through the skin and into the blood supply. Do we know that particularly about cannabinoids? No, there hasn't been enough studies on transdermal patches to determine whether or not a raised body temperature affects the distribution. We know that patches in the cannabis world, these transdermal patches, they're expensive compared to other routes of administration. I'm going to show you what's available on the market right now so you can get a kind of a comparison. They can be difficult to locate and they're not available in all states, and they can have a lack of variable cannabinoid ratios and dosages depending on where you live. Contraindications are not very much. If they're allergic to adhesives or other active substances in the transdermal patch, of course, they want to avoid it. And if they have essential fatty acid deficiency, this is really more the literature talks about for pharmaceutical types of patches. So those high blood pressure patches, the birth control patches, the pain patches. I'm not sure whether or not the essential fatty acid deficiency applies to cannabinoid transdermals. But the benefits, I think, are many, and I wish it was more accessible and more affordable for patients, because these transdermal patches, when they work, can improve absorbency in patients who have metabolism issues, dysfunctional gut, liver disease, those who need to be careful of potential drug-to-drug interactions. It can improve compliance in patients who might struggle with multiple doses throughout the day. They can have a longer duration. So patches can work anywhere from 6 to 12 hours, and some of them are actually 4 days, 96 hours. They can have less side effects, again, because they're not going through the liver. It may not be as intense of a THC psychoactive experience. But my favorite thing is that they can be removed if the side effects are too much. And this is great for somebody who is really hesitant to try cannabis, particularly THC, or maybe somebody who's had a bad experience in the past and is leery of trying again. This can really give them a lot of control over their experience and allow them to ease into using cannabis again and remove it. A lot of times those side effects will go away in about 30 minutes. Again, avoids that first pass metabolism. So if we are worried about liver disease, if we're worried about drug-to-drug interactions, this is a really safe route of administration. It's able to absorb through the epidermis and enter the bloodstream through blood vessels, and it allows for a more steady drug delivery. So again, I think about this in my patients who might have chronic pain, really severe anxiety, nausea and vomiting, where they can use this route of administration to allow them to get a longer effect and not have to worry about redosing, where they may sometimes forget, right? And we try to do 3 times a day or 4 times a day dosing, which sometimes things like tinctures and edibles require. People can forget their dose quite easily and lose some of the benefits because they're not keeping up with their dosages. So what kind of patches are out there? This is not an exhaustive list. This is just what I've seen on the market. Mary's Medicinal is available in states that allow for adult use or medicinal cannabis, and not every state. I'm not sure how many states are in at this point. Definitely my favorite transdermal patch. They are designed to penetrate the skin and reach the bloodstream. Not all of these transdermal patches that I'm going to show you actually guarantee that. And that's what I want to talk about a little bit too. I think Mary's Medicinals has the widest range of different types of patches. They have a THC that comes in either indica or sativa. They have THCA, CBD, CBN, and then a 1-to-1 ratio patches. You can also find that they have hemp CBD patches, transdermal patches that you can order online. They recommend an 8 to 12 hour efficacy. I would say my patients get between 6 and 12 is unusual, but I'd say between 6 and 8. And they range from $11 to $15 a patch, depending on the state. And that is before taxes for many of the states. So they can be really expensive. Imagine if somebody needs 2 to 3 patches a day. The one thing I'll say about Mary's Medicinals is that you can cut the patch into smaller pieces, and you will see a equal dose in it because it is 3D printed. So they do guarantee that if you cut it into smaller pieces, you'll get you'll still get, a consistent dose. The MUV 72-hour transdermal patch is available only in Florida, and it promotes that it releases THC at 0.24 milligrams per hour for a total of 20 milligrams THC per patch, and that's $15 a patch. I don't see anything in their patch to give me confidence as a clinician that the THC is being released at 0.024 milligrams per hour. So I think it is a bold claim. But if anybody has any experience with patients who've used it, please let us know. We also see some other states like Oregon has Synergy Skinworks that says it's a 24 to 36 hour release. They do have different types of THC and CBD ratios and dosages. Again, nothing really in there that gives me confidence that these patches can release between 24 and 36 hours. And they are expensive. And I think a lot of consumers don't really know how to use these patches appropriately. Papa and Barclays, this is a California company that releases some different ratio of just THC and CBD. Their patches also have other additives like menthol, which is thought to help penetrate the skin and get the medication in through the skin and into the blood supply. But some people are allergic to menthol, and it can have a really strong odor, similar to like a Salonpas or Bengay. Hemp-based, you'll see Social CBD, which is THC-free, which promotes a 24-hour release. It comes in 60 to 100 milligram patches. And Pure Ratios is a 96-hour hemp extract patch that has CBD of 40 milligrams. These last two patches are not, the manufacturers do not recommend that they go on a thin layer of skin. So they recommend that they are applied to the areas where there are pain. So there's that localized transdermal effect versus when you're looking at Papa and Barclays, Synergy Skinworks, sorry, Mary's Medicinals, and the MUV 72-hour. These are designed to penetrate the skin and reach the bloodstream. So there are different types of transdermal patches. I didn't get into transdermal topicals. Again, those are going to provide much more localized relief. So I want to talk about a couple cases where transdermal patches have been, I would say, remarkably helpful in patients where nothing else seemed to really work. This is one of the most interesting cases I've had in a while. It's a 67-year-old with pancreatic cancer, and he was undergoing chemo and experiencing severe nausea and appetite loss. He had tried 3 different antiemetics and continued to experience nausea when starting to have extreme weight loss. Now, I knew that his social history and work history was that he was a retired judge. I did not know that he was the assigned DA for 25 years for marijuana offenses in his county. But because I knew that he was a retired judge, I was actually a little concerned about how he was going to respond to my suggestion of cannabis for his nausea. He had tried so many other things that I didn't really know what else I could potentially offer him. I knew that he was cannabis naive. So during the consultation, as I'm going through his health history, and I said, I think there's something I'd like to recommend, and I don't know how you're going to respond. And both him and his wife got this huge grin on their face. And the wife started to kind of laugh, and she said, if you're talking about marijuana, she said, we have all of these products that our friends have brought over, and we don't know what to do with them. And so we started to have the discussion around what would be best for him in his situation. And because he was having such severe nausea and appetite loss, I wanted him to have, THC or THCA. I wanted him to inhale it. And unfortunately, that was not an option for him. He was not comfortable with that route of administration. So I did recommend a transdermal patch for him. And we decided on THCA, because I knew it would help a lot with nausea. And if we could control his nausea, his appetite would likely come back. So we didn't need to necessarily start with THC. So we got the patch, and I had him cut it into quarters. So he's actually getting 2.5 milligrams of THCA in the patch. And his nausea was completely resolved within a couple of days. It was really quite remarkable to see how well he had responded to it. And so when we met up again after a couple of weeks, I said, how are you feeling about, the fact that you're using cannabis and you spent 25 years of your life, basically putting people behind bars for the use of marijuana? I really wanted to know how he was processing that. And he said, I've gotten educated now, and I can look back and realize, I wish I had been educated then. I might have approached things differently. This is a 64-year-old with stage 4 breast cancer who had been experiencing severe retching from her chemo regimen. She couldn't even keep water down. The minute she put water in her mouth to try to rinse it out, to get the taste of vomit out, it caused her to gag and throw up. She had lost 20 pounds. She had poor quality of life. She would sit on the video visits with me with a bag and a bowl in front of her because she just didn't know if and when she was going to start retching. She couldn't tolerate the standard antiemetics because she got severe side effects of migraines. And she couldn't, of course, then that just made her feel even more nauseous. And she was facing a dose reduction of her chemo due to the nausea and vomiting and side effects, and was told that the chemo was actually working for her. So she was now also facing a lot of anxiety around wanting to continue this chemo that was going to provide her with some life extension if she could tolerate it. So she lives in Santa Cruz County, so it wasn't a stretch to offer her cannabis as part of her treatment regimen. And she had actually said, I've been smoking little puffs here and there, and that kind of helps. So we talked about the patch because, even when you're retching so much, the thought of trying to inhale can be really difficult for people. Even though I knew that would work really quickly for her. So we also started her on a THCA patch, and we were finally able to get her retching under control. She would go in for her chemotherapy regimen and actually had great quality of life. She would come back on the video. She would be eating. She would be smiling. She was a completely different person. And then, unfortunately, due to the nationwide shortage of some of these chemotherapy drugs, they had to switch the chemotherapy drug that she was using to a different one. She went from carboplatin to cisplatin, which is probably one of the most notorious chemos for nausea and vomiting and retching. And unfortunately, we have not been able to get her nausea back under control, even with an increased dose of inhalation, an increased dose of the patch, and multiple different suppositories for nausea. So she did initially get really good results, but even then, cannabis wasn't providing her with much relief. And this is an 88-year-old with severe spinal stenosis, unable to move around as much due to the pain, relatively healthy, taking medications for high blood pressure, lisinopril and amlodipine. And she was using Tylenol, 1,000 milligrams every 8 hours for pain with mild relief. She was showing some signs of mild cognitive impairment, definitely forgetful during the intake, unable to really recall how her pain affects her, or how much pain she has, and had never used cannabis before. So this is a situation where the thought of giving her an edible doesn't sound like a good idea because she may definitely have unpredictable results. She's not going to inhale. I'm not sure that a topical is necessarily going to help her either, but some of the transdermal patches that provide more of a localized regional benefit, I think, are most appropriate for her. So we decided to go with the 96-hour hemp CBD patch. And she actually did get really good relief from that patch and was able to move around a little bit more and stop her Tylenol use. And just some clinical considerations when we are considering transdermal patches for our patients. They can be really effective for nausea and vomiting, especially when inhalation is contraindicated. They can be ideal for those who are worried about drug-to-drug interactions. They can be good for those who are hesitant to try cannabis and want some control over their experience because they can be removed and side effects can resolve quickly. And again, they can provide longer lasting relief, reducing the need for multiple dosages throughout the day. So it can really help with compliance in those that we're concerned about. All right. And with that, I'm happy to take any questions, comments, or concerns.